Hi, my name is Desiree and I am a high school student and a Girl Scout. I am working towards my Girl Scout Gold Award, which is the highest award a high school Girl Scout can earn. For my project, I am addressing the topic of computer vision syndrome among teenagers. It is important to learn about computer vision syndrome, and since we have school online now, we need to learn how to protect our eyes. In this video, I will cover what computer vision syndrome is, aka CVS, who is affected by it, what causes it, the symptoms of having CVS, and how it can be prevented. I will also have a message from the expert. Her name is Dr. Maria Richman, and she is an optometrist. In the end, I will be sharing the survey results I had conducted with about 100 teenagers. What is computer vision syndrome? Computer vision syndrome is the strain on the eye from repetitive exposure to screens. About 50% of children and adults are affected by computer vision syndrome, especially those who are using their computers every day. Computer vision syndrome can be corrected and prevented by wearing computer glasses with anti-reflective coatings and other methods that I will talk about on a later slide. Who is affected by CVS? Well, young children, teens, adults, and seniors are all affected by CVS. CVS can affect you regardless of age. Also, the more time you spend on the screen, the more likely it is to have CVS. This is why it is easier to get computer vision syndrome for the working adults who have jobs requiring them to use their screens all day. Also, teenagers now can get CVS pretty easily, too. Since we have online schools, most teenagers are using Zoom and digital screens for at least 9 to 10 hours a day, which is a lot of time. Also, teenagers now mostly have social media, which will increase their screen time. So, what are the causes of vision syndrome? Some causes are poor lighting, a glare on the digital screen, brightness of the screen, and uncorrected vision problems, such as near and farsightedness and strain on the eye. Also, improper viewing distances of the screen and poor sitting posture while using the computer screen can cause computer vision syndrome. The top of the screen should be your eye level. Your screen should be about an arm's length away from your eyes. What are the symptoms of computer vision syndrome? Some symptoms are eye strain, headaches, blurred vision, dry eyes, and neck and shoulder pain. These are all symptoms that many people have experienced before and are very uncomfortable for most people. Although computer vision syndrome can be corrected, it is better to prevent it from happening the first time. The easiest way to prevent computer vision syndrome is to take breaks from looking at the screen. The best way is to take regular eye exams at your optometrist's office. You could also adjust your lighting and angle your screen to avoid glare. Use an anti-glare screen, or adjust the windows in your room to prevent glare reflected onto your screen. Adjusting your body position with the computer screen about 15 to 20 degrees below eye level as measured from the center of the screen, and having your computer 20 to 28 inches from your eyes, which is about an arm's length away, could also be helpful. Blinking in general, especially while looking at screens for long periods, can help to prevent computer vision syndrome. Another important way is to follow the 20-20-20 rule. This is, for every 20 minutes, look at something for 20 seconds, that is 20 feet away. The next slide I will be sharing is the message from the expert. I am very happy to have Dr. Richman explain to us what an optometrist does, how they diagnose patients, the steps they take after diagnosing, and some suggestions and recommendations. Before I share the message from Dr. Maria Richman, I would like to give the definitions of some key terms that she will mention in the video. The first word is distance acuity. This is the ability to recognize small details with precision and is usually tested with the Snellen chart, which is the chart at most doctor's office and the chart where the letters get smaller as the page goes down. Near acuity is like the normal school eye tests, but with glasses on. it determines if you are legally blind. Astigmatism is when the eye does not focus light evenly on the retina. If you have ever seen that the red or green traffic lights at intersections look like there are colorful lines shooting out of it, then you may have astigmatism. Binocular vision is how well your eyes work together, and your accommodative system is your focusing system. Cataracts are when the lens of the eye becomes progressively opaque, resulting in blurry vision, and glaucoma is the increased pressure in the eyeball, causing a gradual loss of sight. Now here is the message from the expert, Dr. Maria Richman.
Hi, I'm Dr. Maria Richman, and I'm a doctor of optometry. Do you have any signs or symptoms of computer vision syndrome, also known as CVS? If so, I would recommend you have a comprehensive eye exam with your eye doctor. If you came to me, some of the areas I would be looking for would be measuring your distance acuity or your near acuity and make sure that the letters aren't blurry. If they were, I would look into seeing if you had any nearsightedness or farsightedness or astigmatism, and if so, I would prescribe glasses to clear your vision. Other areas that would be very important during an eye exam would be checking your binocular vision, how your two eyes work together, and also check your accommodative system or your focusing system to see how your eyes are focusing while looking at the computer screen for a period of time. If your eye muscles aren't working appropriately and maybe your eye drifts out every now and then, that can give you blurry vision on the computer. And if your focusing system isn't strong enough, the vision can go in and out of focus while working on the computer. So if any of those areas are detected, I would consider prescribing special types of glasses, and they may be prism glasses or bifocals. And I also might look into vision therapy or eye exercises. Another area I'd pay attention to would be checking the health of the eye. Sometimes I pick up dry eyes as a problem with computer vision syndrome patients, but I also want to check things like cataracts and glaucoma and other eye health and systemic conditions that can manifest in the eye. Did you know that there's studies that correlate dry eyes with computer vision syndrome? And that's common because if you stare at a computer too long, sometimes you'll see that you don't blink enough. And if you don't blink enough, your eyes get tired and dry and blurry and they bother you. And if the doctor measures that to be the case, there's treatment to address the dry eye condition. So as you can tell, there's lots of things that go into computer vision syndrome, and the best way to take care of it is by scheduling an appointment to see your eye doctor. Thank you.
Now I will share the results of the survey that I had previously conducted. I found from the survey that the majority of the people did not already know what computer vision syndrome is. Also, about 60% of the people I surveyed turn up the brightness of their screens to 60% or above, which is too high. Most people have no glares on their screens while they are working, and most of the students use their devices for around 9 to 10 hours a day, including school time, mainly because of online school. Has experienced at least one of these symptoms, and some have even experienced multiple. Here are 3 sources for you guys to look at if you want to learn more about this topic. I have also put these in the description below for you guys to click on. I would like to thank Dr. Maria Richman and the 2020 team. Cherish, Noelle, Jessica, Emily, Sanvi, Shayla, Selena, Millie, Haley, Lucia, and Maggie, and Slides Carnival. Thank you for watching.